schizophrenia. Schizophrenia really is a chronic, severe, and debilitating brain disease. It affects probably about 1% of the population. In the U.S., at any given time, there's 2 million people that are diagnosed with schizophrenia in any given year. Seems to occur as frequently in men as it does with women, but with men, the age of onset seems to be a little bit earlier. I found that in my practice too. Most of the first symptoms or psychotic break that a person experiences with men, usually in their early 20s. Sometimes with women, it can be in their 30s and even 40s, but they can be their early 20s too. Higher percentage of men definitely have earlier onset of symptoms. Schizophrenia usually from a public standpoint tends to be the crazies or the homeless people. Schizophrenia, really, we're not sure what causes it. There's definitely some neurotransmitters that are indicated, and research is being done by that. But what you usually see, the behavior associated with schizophrenia, is very bizarre behavior, including disorganized speech, thoughts that are fleeting or disorganized, hallucinations or delusions. Most people think of schizophrenics as the paranoid type, a paranoid schizophrenic that's hearing, that's having signals from Mars sent in through his fillings on his teeth. It's kind of a humorous way to look at it, but that's how bizarre some of the symptoms represent themselves in somebody with schizophrenia. So overall, we want to look at schizophrenia as probably one of the most severe brain disorders or form of mental illness that there is, and it can be confused sometimes with severe bipolar disorder or major depression.
I was about 29 years old when I started noticing symptoms, and I was teaching at a university. I didn't know what could be wrong. I didn't know very much about schizophrenia. Something wasn't quite right. I think it was just that my life was too difficult to handle. And I remember remarking to someone that something didn't seem right in my head. I had severe insomnia. There were definitely some strange thoughts. And I had a really difficult time managing stress. When I was hospitalized, I was initially hospitalized at Western Psychiatric Institute and Clinic. They assigned me to the STEP clinic. They're equipped to handle a crisis situation. Because of the stigma surrounding schizophrenia, I didn't want to be identified with the illness. It was just overwhelming. Initially, the group therapy was helpful. One-on-one therapy was also really helpful. It's not easy, but once you get the meds right and feel like you have a normal that you can live with, it's very livable. Don't delay in getting help. Don't be afraid of the diagnosis. The faster you get a diagnosis, the faster you can get on the road to recovery.